Sixth month of pregnancy. 6 months of pregnancy, characteristics and symptoms. The sixth month of pregnancy comprises weeks 21 to 24 of gestation. At this time, the development of the fetus is in a very advanced state, since half of the entire process has been overcome. At 6 months we reach the end of the second trimester, which is usually the most comfortable for the pregnant woman. The changes continue to happen for both the mother and the baby, who already acquires a fetal position in the womb. Symptoms in the future mother. Symptoms suffered in previous months become more acute in the sixth month of pregnancy. Here are some of them. Stretch marks. The skin is stretched in a much more evident way due to the growth of the baby, which can cause itching and stretch marks. Spots on the skin. Spots may appear due to the increase in estrogens. These hormones activate melanocytes, the cells that make melanin. These darker areas, especially on the face, are known as cloasma or mask of pregnancy. Increased frequency of urination. The baby's movements are much more marked than in the previous month since each time it has less space. This, in turn, causes it to put more and more pressure on the bladder, so the need to urinate increases. Back problems. The weight of the amniotic fluid, the placenta and the fetus itself can cause back problems in the pregnant woman. Appearance of colostrum. This liquid is the precursor of breast milk and is produced by the mammary glands a few months before and a few days after delivery. Colostrum losses can occur at any time of the day and are normal. Protective discs can be used over the nipples to prevent the clothing from slipping. These symptoms can be more or less annoying. It all depends on the characteristics of the woman and how the pregnancy itself develops. In any case, when faced with an unusual situation, it is advisable to contact the doctor who is monitoring the pregnancy. Changes in the baby. Although the baby is already quite large, he still has some freedom of movement in the womb. This allows you to be very active. The most obvious changes at this time of pregnancy are the increase in weight and length of the baby. On average, at 6 months pregnant, it can weigh around 750 grams and measure up to 35 centimeters. His body is more and more proportionate and is acquiring a more human shape, especially in facial features, as eyelashes and eyebrows are beginning to form. It is more or less in this month when the baby can open his eyes and is able to respond to certain visual stimuli. His skin is still thin even though it starts to wrinkle. Even so, it is no longer translucent, as it has acquired a reddish color due to the capillaries becoming transparent. However, some layers of fat have yet to accumulate under the skin. The ear, which had already begun to develop the previous month, is perfected during these weeks and can already distinguish the voice of other people besides that of its mother. Another sense that continues to evolve is that of taste. By the end of this month, taste buds have formed, allowing the baby to begin to distinguish flavors, since she can already swallow and ingest amniotic fluid. His lungs are still very immature. In fact, since they are not essential until the moment of birth, they are practically the last organs to form. By now, they are filled with amniotic fluid, and the alveoli have not yet fully developed. Subscribe to the Mother channel and happy pregnancy to receive more tips on pregnancy. Thanks a lot.